Hello everyone. So today we'll be discussing about the recent mock interview questions about HCC or risk adjustment Optum interview questions mainly asked in Hyderabad. So if you are watching my channel for the first time, please do subscribe so that you will get regular update of the interview questions as well as about the vacancies, and some days there might be classes also. So welcome to Learn with Dhanya. In this video we'll be talking about the most important interview questions for freshers medical coders and how to prepare these questions. So in this I have added the recently asked question from Hyderabad location for Optum. So you can make a note of these questions, and when you're preparing for your interview you can prepare these questions also. So Section 1, domain or technical round. First question they have asked, what is HCC coding and why is it important? And second question, what documentation is required for support and HCC diagnosis? Third, how do you differentiate between acute and chronic condition? Fourth, patient has COPD with acute exacerbation, how you do code? Fifth one, a patient has type 2 diabetes with CKD stage 3, how would you code? And sixth question was, what is the difference between ICD, CPT and HCPCS? Seventh question was, what are the common errors in HCC coding? Eighth question was, explain the difference between HCC RAF score and coding accuracy. Ninth, can you explain the significance of chronic condition in risk adjustment model? 10th, what is the golden rule when documenting the coding? Don't align. And section 2, case scenarios. The question was patient documentation. 72-year-old patient with a history of hypertension and diabetes. He is on metformin. A1C 9.2%. Complaint of blurred vision. Diagnosed with diabetic retinopathy. The question was, how do you code? And second question, patient with CKD stage 4 and dialysis. Documentation state ESRD. How would you code? Section 3, anatomy and physiology. Explain briefly the cardiovascular system. What is sepsis? What is a structural and functional unit of kidney? Which cranial nerve is called as wandering nerve? And which chamber of the heart pumps oxygenated blood to the body? Which type of joint is a shoulder joint? And name the largest gland that is present in the human body. So the next question which was asked was, where does gas exchange occur in the lungs? Which hormone regulates blood sugar by lowering glucose level? What is the primary function of red blood cells? Which bone is called as the collar bone? So these are the anatomy and physiology questions which was asked during the interview. And then Section 4, behavioral or HR type of question. Tell me about yourself, why you are choosing Optum. Tell me about a time you handled pressure at work. What are your strengths and what are your weakness? How do you keep yourself updated on coding changes? These are the questions which were asked. Okay, so you can prepare those questions. And finally, quick rapid fire. In that, difference between history of cancer versus active cancer. Next question, can you code probable pneumonia? Next question, if provider documents hypertension CKD stage 3, how would you code? Next question, why is annual coding important for HCC? And the next question, what steps do you take to ensure accuracy in coding? So that's all about these questions. Thank you for watching. Hope this session helped you to understand the key concept and boosted your confidence for the medical coding interview. If you have found this video helpful, please don't forget to like, share and subscribe. Learn with Dhanya for more interview focused content. If you are preparing for your medical coding interview and need personalized interview guidance for placement support, feel free to contact. You can just WhatsApp me in the given number 81481999269. Thank you so much for watching, and please do share this video with your friends also so that it might be helpful for them while preparing their interview. Thank you so much. Take care. The next video will be updated by tomorrow the same time. Thank you so much.